All right, you guys. Welcome everyone. Welcome to our students and your families and your friends who are here with you, and the people who are joining us online who couldn't be here. We're so excited to celebrate this special and important day with you. I'd also like to say welcome to Dean Compton, Dr. Bernardo, Dean Brown, all of our faculty and staff. Thank you. We're glad everybody's here. And we have a packed agenda today. We got to get to the most important parts as fast as we can, right? But we have some things we're going to do before that. I just want to take a moment to reflect from a public health perspective. Some of the things that are currently happening that are challenges for all of us. And they threaten the health of people's health and well-being. And it makes our work in public health more important than ever. We're still mired in the throes of a global pandemic. Our planet is warming, which affects the foundations of health everywhere. Wars and conflicts causing humanitarian crises around the globe. And our nation continues to argue over what it means to have basic human rights. Now, all that seems really daunting. And it also reflects the opportunities that you and we have to tackle these major existential challenges. And by doing so, we can make the world a better and safer and healthier place. So you're graduating in a time of incredible need, and we are relying on your expertise and your energy more than ever. We're with you, and we thank you. Now, let's get on with the show. I'd like to invite Dr. Manish Mishra to the podium to introduce our Class Day speaker.
Good afternoon. My name is Manish Mishra, and I'm the Director of Professional Education and the Interim Director of Student Affairs. Before I introduce our keynote speaker, I'd like to just offer a sincere congratulations to our graduates today and a really warm welcome to the families who've traveled to be here. Families, you loaned one of yours to us for a brief period. And in that time, we thought deeply about the sciences of public health. We thought deeply about biomedical sciences. And now as they return to your family full time, I think we collectively need to think about a third science. And that's the science of gentleness. Being gentle with strangers, offering hope and realistic optimism when the odds are unlikely. That's the secret sauce to healthcare. And it takes effort. It takes effort to challenge that baseline, oh, this is never going to work, that baseline doubt. And it's hard. It takes practice. It takes practice and takes support from everybody's loved ones. Your graduates, your family members who are graduating today, they're going to be facing impossible challenges, as Craig just outlined. So that's why I'm inviting you as families to partner with your newly minted graduates. Make it explicit. Partner with them. That when this gets hard, we're going to share this grief. We're going to get through this, and we're going to support you all the way through. And that's why I'm so honored to introduce our speaker today. Our speaker today is Dr. Greg McKelvey, and he's worked in almost every facet of healthcare, private sector, academic, and now in civil service. And he's pulled this thread of gentleness all the way through every one of those spaces. Dr. McKelvey serves as the Assistant Director for Biosecurity at the White House in their Office of Science and Technology. There he focuses on minimizing risks from the catastrophic misuse of emerging biotech. His training includes a master's in public health from Johns Hopkins Bloomberg School of Public Health and a medical degree from Dartmouth. But prior to working at the White House, Greg led healthcare product teams at 2 machine learning startups, designing and deploying some of the earliest operational machine learning models into patient care settings. And then he led data product teams with the COVID-19 task force, their data strategy and execution work group out of Washington. He's a 2020 fellow of the Emerging Leaders in Biosecurity Initiative at Johns Hopkins at their Center for Health Security, and he was named the 2021 Fellow for Ending Bioweapons by the Council on Strategic Risks. Perhaps most importantly, through all of this, he's been rationally optimistic and extremely kind. The whole way through, every step and every one of those touchstones. So please welcome home our Class Day speaker, Dr. Greg McKelvey.
Thank you, Dr. Mishra. Thank you, Dean Compton, Director Barnato, Executive Director Westling, Directors Thoreau and Pissot, TDI faculty, and staff. But most of all, thank you, TDI Class of 2022, for the privilege of sharing this moment with you and your loved ones. I believe I was asked to speak to you today for essentially one reason. Approximately 80,000 hours ago, a number whose significance we'll return to shortly, I was sitting there where you are. And standing here now, after a meandering professional journey, I'm employed by the Executive Office of the President of the United States. But I believe that this fact says more about you than it does about me, because it is a useful existence proof. It demonstrates that once you exit this stage with your TDI diploma, you can keep walking as far as you want in any direction, and you will be taken seriously. Unless, of course, you are still dressed like this after today, in which case, your credibility will be seriously questioned, Dartmouth degree or no. Even over Zoom, by the way. What I mean is that it is now fully within your ability to further climb the ivory tower or descend to fight in the front lines or trenches of patient or population healthcare, to wander the market bazaar of industry and technology, or to enter the halls of policy and governance, if you so choose. Said another way, you now have the professional capacity to access essentially anywhere, which is an interesting fact, but not nearly as interesting as the question that this invites, perhaps the most consequential that you will face in your professional lives. What will you do with this access over the next 8 hours a day, 5 days a week, 50 weeks a year, times 40 years, or approximately 80,000 working hours of your remaining career? Now, that is a heavy question. Before hefting it together, let's take just a moment for something lighter. I'm far from the first or the last person to congratulate you today, but it has been my experience, and others can back me up here, that no one will ever take the trouble of addressing you by your now proper title. So let me be probably the first and the last to say congratulations, Masters of Science of Public Health, both residential and hybrid. One definition of mastery is the ability to control outcomes. And after reviewing your remarkable ILE presentations, where you tackle problems ranging from maternal telehealth to the repercussions of tackling itself and consequent head injury, it is clear that you've acquired the knowledge necessary to effect truly consequential outcomes. So let me be also probably the first and the last today to say condolences, Masters. Why condolences? Well, because of the debt that you've incurred by being here. No, don't worry. That is not a student loan joke. We all know there's nothing funny about those things. I personally have hundreds of thousands of reasons never to laugh again about anything. No, I'm merely reminding you of your obligations under the Bacon-Parker principle. And for those who are rusty, Francis Bacon in his 1597 Meditations wrote that knowledge itself is power. His collaborator, Stan Lee, in the 1962 comic book sequel to Meditations, Amazing Fantasy number 15, added, "With great power, there must also come great responsibility." Therefore, the masterful knowledge that you now possess also entails responsibility. And I'm afraid this obligation is of a special kind for you TDI graduates. Let me demonstrate. By show of hands, when applying to Dartmouth, how many of you said you wanted to come here because you wanted to help people or even to save lives? Me too. And you see, whereas the folks at the college or at Thayer or Tuck merely have the obligation to refrain from abusing their learning, and at Geiselmed, I didn't realize that was a laugh line, I'm sorry. And at the MD side, we swear an oath to help one patient at a time. You, however, have signed up for the knowledge to help people at the greatest possible scale. You've asked for and now received a superpower. This is indeed a great responsibility. But don't worry, we are in the same boat, obligation-wise at least. I am clearly not a superhero. I am a bureaucrat. Russell Wilson, however, may be a superhero. But not only did I also sign up for the same thing as you 9 years ago, I now serve an office whose mission is to maximize the benefits of science and technology to advance health, prosperity, security, environmental quality, and justice for all Americans, which is just a fancy way of saying that we too are on the hook to help as many people as possible using knowledge. Now, my usual approach to this mission is to try and make biosecurity and pandemics boring again through the medium of extensive paperwork. But today, instead, I'm speaking to you. And this is not coincidence or mere ceremony. I fully believe that by doing so, I'm both fulfilling my mission and buying down a portion of my debt by hopefully helping you to think for a moment about how you will buy down your own. But that's fairly selfish. It mostly helps me. It doesn't help answer the fundamental question before us. You're sitting there with a new superpower. What could or should or will you do with it? Unfortunately, I have no idea. Since leaving Hanover, I've been reminded again and again that I'm terrible at predictions. Had you asked me at any step of my career to anticipate the next, I'd have failed both confidently and spectacularly. So I'm disqualified from offering you foresight today. But I didn't show up empty-handed. I brought you a gift in the form of a thought experiment and a couple of the tools that others were kind enough to loan me for my own journey. First, the thought experiment. Are you ready? Close your eyes. Open them. Look around. It's 1922, the second year of the Harding administration. Here we sit in a field. Baker Berry Library won't be built for another 6 years. Just behind you in time lies the recent end of years of expeditionary war, the great financial crisis of 1907-1908, the worst pandemic in living memory starting in 1918, and an ongoing conflict involving Russia and its neighbors. In other words, it was a different time, but one not entirely dissimilar to our own, unfortunately. You couldn't have known it then in 1922, but ahead of you lies financial depression, World War, famine, genocide, the weaponization of atomic energy, decades of existential standoff, and innumerable injustices at home and abroad whose consequences will echo well into the following century. You couldn't have known it then, but ahead of you also lies the flourishing of rights movements, opposing those inequities just enough to reveal the long arc of the moral universe and its bend towards justice. Ahead of you also lies advanced technology, indistinguishable from magic, bringing unexpected insight and plenty, lifting billions from poverty, propelling humanity's feet to the moon, even while the hands wielding those most terrible weapons would remain unexpectedly stilled. But you would know none of this on a lovely June afternoon in 1922. So how might you have made the decision about where to apply your new powers to help as many people as possible, knowing that you were blind to even the most epic contours of the century before you? This is where the retrospectoscope comes in handy. As you know from your long educations, the answers are always at the back of the book. And in 1999, my CDC colleagues conducted a wonderful retrospective of the 10 greatest public health achievements of the 20th century. What they found was striking. The 1922 versions of yourselves achieved greater than 90% reductions across many of the greatest public health problems that we then faced, resulting in a miraculous 30-year gain in life expectancy at birth by century's end. They also found something else, unexpected and instructive, that even among these biggest of wins, the impacts in terms of lives saved varied by orders of magnitude. For example, in my own field of occupational medicine, heroes like Dr. Alice Hamilton were able to reduce the rate of worker fatalities from 1 in every 2,500 per year in the 30s to 1 in every 25,000 by century's end. This was a phenomenal achievement. CDC calculated it was the equivalent of averting 40,000 deaths per year when they ran their numbers in 1997 data, a truly massive impact. Yet if we look just next door on the list, we see something even more astonishing. US infant mortality in 1922 was a staggering 85 in every 1,000 live births. Today is about 6. Had the early 20th century's death rates carried into the 1990s, it it would be the equivalent of an extra 500,000 infant deaths every year in the US alone. A steeper risk affecting a larger portion of the population yielded a greater than factor of 10 difference in the size of opportunity to save lives. Of course, I don't mean to suggest that everyone here should be crowding around to work on the same problem, neglecting crucial others. I do mean to suggest, however, that if you aren't working on a problem that's causing massive harm, that you deeply examine the reasons why, given that you now have a superpower that applies to problems of any scale. Of course, tractability also matters. It's probably better to solve a significant smaller problem than to founder against a larger one. So if you are the Alice Hamilton in the audience, please go and find and solve the 21st century equivalent of occupational medicine. But if you're unsure where your comparative advantage lies, as most of us are, why not go big? At the very least, it will protect you against the dreaded Hamming questions, which were posed to me on my first week of the job at the White House. Richard Hamming was a renowned mathematician at the legendary Bell Labs. He used to drift among the various groups of researchers in the cafeteria at lunch and ask 3 simple questions. 1, what are the most important problems in your field? After a week or so of listening, he'd ask, what problems are you working on now? And after intently absorbing for a couple more days, he'd finally close the trap. If what you're doing is not important, and you don't think that it is going to lead somewhere important, then why are you at Bell Labs working on it now? He eventually ran out of people to eat lunch with. But his legacy has been a useful goad to impact-minded folks ever since. So let's say you decided to walk off the stage in 1922 and attack infectious diseases of childhood, and we now know that you could have succeeded beyond your wildest hopes. Pulling the threads of how this actually happened reveals 2 useful and fundamental approaches. In 1922, pertussis or whooping cough was killing about 6,000 US children each year, comparable to nearly 20,000 per day today. The chain of discovery for solving this problem with vaccines has about 7 steps. In 1922, only step 1 was solved. We knew the bug, Bordetella pertussis, but it was hard to grow, and there was no effective therapy demonstrated at scale. Starting in the 1930s, public health researchers, Drs. Pearl Kendrick and Grace Eldering, sequentially and successfully attacked every remaining link in the chain to solve this problem. They figured out how to grow, isolate, and weaken the pathogen. They conducted sterility and safety tests by injecting their own arms. They designed, funded, and ran some of the first widespread vaccine trials to demonstrate efficacy, and this was well before big trials and national science funding were the norm. They worked with industry to standardize production at scale and NGOs to scale distribution. By 1940, their vaccine was distributed nationally, soon after globally by the newly formed World Health Organization. By century end, fewer than 10 children per year in the US would succumb to whooping cough. Still too many, but the world was over 19,000 tragedies lighter each year than it might have been otherwise. At her passing in 1981, Pearl Kendrick's contribution alone was estimated to have saved hundreds of thousands of lives, an impact undoubtedly in the millions today, and still accruing interest. A second anecdote suggests a parallel approach. Recall the 7 steps in the chain of discovery we just mentioned. For decades, there was a profound bottleneck at step 2, growing pathogens, especially viruses. This is because the cell cultures then in use were both finicky and dangerously contaminated, hampering vaccine development. In 1962, researcher Dr. Leonard Hayflick successfully isolated the first uncontaminated human cell strain capable both of serial culture and resurrection from frozen storage, relaxing this bottleneck. WI-38 would eventually be used to develop or produce the majority of the 20th century's human virus vaccines, such as measles, mumps, rubella, zoster, and rabies, and collectively would save many tens of millions of lives globally through the remainder of the century. A conservative accounting of the impact of this single innovation runs easily into the hundreds of thousands to millions of lives. These 2 techniques have enduring utility, and they're worth recycling for your 21st century toolkit. Going deep into one problem, working backwards from its solution, or attacking a bottleneck, unblocking the solution to many problems at once. Now, contrarians amongst you, and I would have been one of them, may be thinking, well, if people are working on every problem, someone's bound to get lucky and in retrospect look like a hero just because of chance. And you'd have a point, that chance does play a role. But I'd like to submit that it is easy to underestimate just how scarce a resource people like yourselves actually are. There are just not enough superheroes to go around. And to the extent that their efforts are not optimally allocated, there really are opportunities to help people at massive scale just lying around, but for the right people to become obsessed with solving them. The market for saving lives is far from efficient. This is as true in 2022 as it was in 1922 and 1962. The well of opportunities to help people or save lives at scale hasn't dried up. Just since my own graduation in 2013, approximately 1 million malaria deaths have been averted through efforts such as scaling up insecticide-treated bed nets. In our current pandemic, the unbelievably rapid development of mRNA vaccines by folks like my OSTP colleague, Dr. Matt Hepburn, have helped to save millions of lives globally over the past 2 years. An individual with knowledge like yours can have a disproportionately positive impact on the world. And while this is far from certain, it is also far from random. Luck can be courted or even reverse engineered. If you combine the skills you now have with the aspirations that you began with, you can take more and higher quality shots on goal against the biggest problems that we collectively face for the rest of your careers. There are quite literally billions of lives waiting to be impacted by the decisions that you make after today. And you will have that impact if you are as intentional and rigorous about the choice of problems that you attempt to solve as the methods by which you've now been trained to solve them. This, I submit, is what it means to wield your superpower wisely. And in closing, it's important to add that you can't and shouldn't try to do this alone, and you won't have to. The real secret of access is that the world has a way of opening its arms and extending its hands when it discovers that you are credibly attempting to better it. You have the folks who got you this far, your friends, family, mentors, colleagues, hang on to them. And now you've joined a community of alumni standing by in support, along with a wider network of fellow travelers stretching to the White House and well beyond. Finally, if I can serve as an existence proof of a final possibility, it's that you'll be back and up here if you so choose. What stories will you then tell about how you chose to use your superpower starting today? I, everyone here, and even everyone not here, cannot wait to find out. Our future quite literally depends on your answers, and so we collectively wish you way more than luck. Thank you.
Thank you, Greg. That was incredible. It's now my pleasure to introduce the two student speakers this afternoon. Student speakers are selected by a vote of their peers, which is a huge honor. And we have two student speakers, one representing the hybrid program and one representing the residential program. I'd first like to introduce our hybrid student speaker, Melissa Lebrun. Would you please come on up here, and I'll embarrass you a little as I describe your accomplishments. Dr. Lebrun is a board-certified family nurse practitioner, an FNP, and the president CEO of Executive Medical Clinic of Lake Charles and executive director, primary care. She is the family nurse practitioner program director in the College of Nursing and Health at Loyola University, New Orleans, and assistant professor in the College of Nursing and Health and the College of Business, also at Loyola. She was raised in South Louisiana, was the first in her family to obtain a bachelor's degree. She earned a bachelor's degree in biological sciences with an emphasis in biochemistry from Louisiana State University in 2005. She then completed her nursing degree in 2007 from Our Lady of the Lake College and her clinical training at Tulane Hospital in New Orleans. In 2011, she obtained a Master of Science in Nursing from Loyola University, New Orleans, and in 2016, she earned her terminal degree, Doctor of Nursing Practice, DNP, from Chatham University in Pittsburgh, Pennsylvania. Dr. Lebrun has a passion for improving access to health care, and she currently works in her community to address the opioid epidemic in clinical practice and public health volunteer efforts. She is the mother of twins, Caleb and Isabella, and loves beach time and reading with her family. She has been selected for a CSTE Applied Epidemiology Fellowship in Infectious Disease, Hospital-Acquired Infections at the Texas Department of State Health Services in Austin. Please join me in welcoming Dr. Lebrun as your hybrid MPH student speaker.
Hello, everyone. I am so grateful to stand here today in front of all of you. I would first like to thank all the faculty, staff, and mentors at TDI for their unwavering support. With your guidance, we are all here today, ready to go out into the public health arena and make a real difference. This is such a surreal experience for me. A few weeks ago, I came home from work, and my kids ran up to me, "Mom, look at my book. It's Dartmouth, and Dr. Seuss went to Dartmouth." And then my son looked at me with an epiphany and said, "Mom, you must be super smart." I said, "Well, son, it's about 50% intelligence and the other 50% determination. So thank you, Dr. Seuss, for allowing me to look so smart in front of my kids." I am from rural Louisiana and moved about 22 times in my 18 years of living with my parents. And no, I am not from a military family. When people ask me why I moved all the time, I just really tell them that my mom liked to redecorate. It's a little easier, right? Even though I went to many schools growing up and always had a great deal of change, it prepared me to pivot when needed to in life. There was a great deal of poverty and lack of access to care in many places I lived. My family also experienced their own poverty and many barriers. However, I was determined to change my circumstance and make a difference. I was the first in my family to complete a bachelor's and then on to a doctorate, and education really changed my life. You see, my grandfather only completed the 3rd grade, and my grandmother the 6th. They were both hardworking, courageous people. My grandmother, Neva Pereira, raised 4 boys and actually worked peeling crawfish for a living at the next door factory. For those not from the South, crawfish is our delicacy, similar to the Norse caviar, right? My grandmother was one of my heroes. I remember holding her hand as a small child once and feeling her very dry, rough skin from her work, and I couldn't have been more proud. And I tell you all this story because her story is the one that encouraged me to go into healthcare. My grandmother had several cancers: skin, kidney, thyroid, but the worst of all was when she was diagnosed with multiple myeloma. She was a tough woman, but this cancer threatened her life more than any of the previous cancers. Cancer treatment is very expensive, as we all know, and she needed a bone marrow transplant and would have to drive over 60 miles each way to her oncologist appointments and for other lab services. My mother and aunt helped care for my grandmother and tried to find ways to cover those healthcare services. So one day, my mother called the Medicaid office with hopes of getting coverage in addition to her Medicare. And after offering all the pertinent information, she was denied coverage. Distraught and confused, my mother asked what she could do to get her that coverage. And the representative simply and coldly replied she would only be approved if she divorced her husband because he made too much money, really a meager Social Security income check. Can you imagine this after 50+ years of being married, thinking your only way to get your cancer treatment is to divorce your husband? So of course this was not an option. The community pulled together and did a benefit for my grandmother, which helped pay for those expenses. The community. She received treatment and lived 20 more years until she was diagnosed with a reoccurrence of that multiple myeloma. And then she passed away. She was my reason for going into healthcare. I wanted to help people like my grandmother. The late Dr. Maya Angelou once said, "Be a rainbow in someone else's cloud." Today, I see all my classmates in many clouds that we face. We began our program in 2020 at the height of the COVID pandemic. At times, it felt like we were on an episode of The Survivor. We studied during time of strife in our world: riots, inequities, wildfires, hurricanes, floods, and mass shootings. And yet, we are all determined to complete our MPH degrees and shine our light in public health. Determination to help others like my grandmother through health policy. We have a senator in our group making legislative changes for his community. We have nurses working on missions globally. We have an author striking down misinformation on social media, cardiologists, rural primary care physicians, nurses, school nurses, professors, researchers, lawyers, engineers, and project managers, pharmacists, and social workers, just to name some of the few fantastic accomplishments of our cohort. They are all rainbows in someone else's cloud. Over the past 2 years, I personally have had some devastating events. COVID took so much away from so many of us. I remember not sleeping at night, worried that I would bring COVID home to my family, and trying to protect my patients from this horrible disease. The intense stress of telling some of my patients they have COVID, and them asking me if they're going to die. I still think about these conversations today. And if COVID wasn't enough, a Category 4 hurricane hit my hometown and devastated my community and displaced my own family for several weeks during a pandemic. Growing up in South Louisiana, I am no stranger to hurricanes. However, it's much different when you have children to protect. And lastly, the most devastating event of my life happened just a few short months ago. My mother passed away, and now a piece of my heart is gone. However, I have been driven by the support of my cohort, faculty, and staff at Dartmouth. My cohort's talents impressed me, but their hearts during one of the most devastating events in my life, I will cherish forever. I was determined to complete this program with the support of my family and friends, and I knew that my mother would never let me give up. Determination to seek healthcare justice that my mother instilled at me at such an early age. Today, I say to all of you, we have started a new journey in public health to improve communities. We must stay determined despite the obstacles, despite the heartbreak, despite adversity, and I know all of you will. And I applaud my MPH cohort and all of your hard work. And lastly, I would like to thank my family for all their support, my spouse Amy and twins Isabella and Caleb, my aunt and uncle here that came all the way from Thibodaux, Louisiana. They never missed one birthday or graduation. My Loyola and executive family, all my sweet friends and family, and last but not least, my dad at home. I love you and thank you for everything. And my mom in heaven, I hope I made you proud. Class of 2022, congratulations.
Thank you, Melissa. It's hard for me to talk. All right, Umair, here we go. I'm delighted to introduce our second student speaker of the day. He's representing the on-campus programs, Umair Shaikh. Umair was born in Portland, Maine, before moving to Indiana, where he spent the majority of his life. He came to Dartmouth after completing his undergraduate studies at Butler University, where he double majored in Spanish and organizational communication and double minored in chemistry and English literature. It's a wide range. During his time in undergrad, he was heavily involved in speech and debate, in which he claimed a total of 14 national titles, as well as swimming and diving, in which he currently holds 3 school records in freestyle and butterfly. In August, he is moving to Washington, D.C. to earn his MD at the Georgetown University School of Medicine. He aspires to use his unique background in conjunction with the skills he has acquired while earning his MPH to transform healthcare by improving the practices of patient-centered communication. Eventually, he hopes to become the United States' first Muslim president. And you thought all that was good. Now we're going to wrap up. In January 2020, Umair was awarded his Doctorate of Pokemon Studies, or PokeD, for his exemplary achievements and contributions to the field of competitive Pokemon. As a certified Pokemon professor, Umair, I'm still not calling you doctor yet, buddy. Umair is able to both officiate and host sanctioned tournaments on behalf of the Pokemon Company International. And I'm not done. When he's not busy studying or posing as Darth Vader in the class group chat, Umair enjoys volunteering at Mount Lebanon Elementary, teaching science to elementary school students, overanalyzing Star Wars, jamming on bass guitar, I think that's bass, and spending time with his incredible friends and family, both back home, at home and here at Dartmouth. Please join me in welcoming Umair.
Good afternoon, everyone. My name is Umair Shaikh, and it is an absolute honor to stand up here representing my classmates during this momentous and defining occasion in our lives. I want to begin by thanking our incredible professors, TAs, program coordinators, admissions staff, APE and IEL preceptors, internship site directors, and each one of our TDI mentors that made and continue to make this program possible. I want to thank all the incredible family and friends who are here with us today, both in person and virtually, for showing us your love and support on this incredible Friday afternoon. And finally, I want to thank my special, wildly talented, trailblazing classmates for electing me to this role and putting their faith in me to be their voice today as I reflect on our abundant, miraculous, at times taxing, but all the same life-changing experiences over this past 1 year. A reflection through the lens of heroism. I do not have the professional experience to offer you career advice, nor the life experience to offer you wisdom. But what I do have, what I can do, is tell you a few quick stories. 3, to be exact. I know 2 is considered better, but trailblazers, remember, so 3 it is. Stories that in their special, unique, and positively wild ways tell of what it means to be a hero. These stories go out to all of you, the heroes who will change the world. This first story goes all the way back to last July, shortly before we in the residential program started classes. We were asked by TDI to send in a brief bio, answering questions like where we were from, what our career goals were, where we saw ourselves in 5 years, and how to pronounce our names. Thank you for that one, by the way. Shortly after, I remember receiving an email stating that our class bio book was ready, and upon opening it, was absolutely blown away by not only the achievements, but the aspirations of each of my classmates. Among our group, I noted we had aspiring politicians, physicians, biostatisticians, epidemiologists, and so much more. But the thing that stayed with me the most was one word. A single word that was common in almost every single bio. Change. I want to be an advocate for change. I want to change the system in this way. I want to change things in a way so people around the country and the world can live better, healthier lives, and that's when I realized the people I will have the privilege to call my classmates are unafraid and instead inspired by the prospect of change. And not only that, but they are going to be the ones standing at the forefront of that change to create a better and brighter tomorrow. Each of them recognizes that the systems we have now are broken and flawed, and that it is our duty as stewards of public health to be the drivers of everlasting change, the hallmark of a true hero. The takeaway from this story is that a good hero is not afraid to shake things up, but a great hero looks forward to it. As your classmate, I cannot even begin to tell you how amazing of a feeling that was. Seeing that each of you had the strength required to embrace a challenge and the courage needed to enact change. And when I came to Dartmouth and met you in person and virtually, my desire to see you all change the world only grew. And today, it is greater than ever. And that's why we're here today, to honor the legacy of our schooling while realizing that our education has just begun. See. My second story takes place just this past weekend. I took a trip down to Hampton Beach, just an hour and a half away from Hanover, and was incredibly excited. When we arrived, the first thing I noticed were the waves crashing against the shoreline. Me, being a competitive swimmer for nearly a decade, simply could not resist the opportunity to test my mettle against Mother Nature. So I hopped in the water, waited for a giant wave to come towards me, and then using my best technique, dove in head first. The resulting sound, which was supposed to be a crisp and smooth sort of landing, was instead something akin to removing a suction cup from a solid surface as I belly flopped directly on top of the wave. In the following seconds, I could not hear much other than the, ooh, yikes, from the people around me. Embarrassed, defeated, and with a front side redder than an apple, I waddled my way back to shore like those penguins who carry eggs between their feet. And therein, that humiliating experience, which is now public knowledge, resides the second secret of being a hero. Ride the wave. The world as we know it is in a state of flux, and it feels like the scales can tip any which way. That uncertainty is scary, but it is also an opportunity to push for systemic change. After all, being a hero is not about saving. It's about serving. The skills we have gained here at TDI have equipped us with the means to tip the scale in a better, brighter, and more hopeful direction. In Professor Wessling and Rhodes' health policy course, we discuss a concept called the Overton window, where the popular mainstream view is the center of the window, and the less popular opinions are either above or below it. At any given time, that window may shift, and it is up to the policymakers to identify when that happens. But this idea extends beyond the concept of policy. Each of us has our own Overton window across several areas of our lives. We don't always know how or why things change. We can think we have it all figured out, but the reality that awaits us tells a different story. But instead of becoming disheartened by the uncertainty, we must choose to cherish the opportunity and celebrate the ability we have to make a difference. We must find satisfaction and contentment in knowing that of all the things changing around us, the only constant is our unyielding adaptability. And when we recognize that truth, we turn what many perceive as a grave limitation into a great strength. So the next time the ocean throws a wave at you, no matter how strong a swimmer you are, welcome the possibility of a belly flop and ride that wave to the shore and beyond. My third and final story takes place almost 2 months ago to date, on Saturday, April 9th. I was given the opportunity to plan a reflective and meditative retreat for my fellow TDI and Geisel classmates. For those unfamiliar, the purpose of a reflective retreat is to look back at the experiences throughout our lives that have shaped us into who we are today, and talk about them in a group setting to gain a better understanding of our own lives, sense of purpose, and calling. Another very important goal is practicing active listening, to empathize with others and their experiences so that we may connect our own growth to theirs. The event was all day from 10 a.m. to 8 p.m. and included faculty leaders such as Roland and Professor Wessling, as well as another student leader, Layla. 2.5 years ago, I lost a very close friend. His passing was unexpected and shook me to my core. Although that may seem like a long time, just as I told the retreat participants that day, there is no logic to grief. You just do it. I realized that my healing process had not yet been completed, and I was still very much grieving. Although these were all thoughts in my head, I hadn't done anything about them. I simply let them sit and pushed them to the back of my mind, hoping that void would just someday go away. But it just so happened that during this retreat, I was surrounded by some wonderful classmates to whom I found myself, for the first time since his passing, truly opening up to and letting everything out. I hadn't opened up to anyone like that before, but there was just something about the presence and the people there that day that was begging me, pleading with me to let myself be vulnerable and speak my truth. I mean this sincerely when I say that day was the most supported, comforted, and loved I have ever felt from a group of peers. I stepped out of Vail that day and I felt as if the weight of the world had been lifted off my chest. Like I could finally breathe again for the first time in years. That day, the future got just a little bit brighter for me as you all shone the light that illuminated my path. The journey towards embracing vulnerability is like turning a jail cell into a garden. And when I needed it the most, my TDI family was right there with the watering can. At that moment, it felt okay. It felt right. And this community is what allowed me to feel that safety. And therein lies the third and final secret of being a hero. Trust in the impact you have on others. You have certainly impacted me. My fellow TDI classmates, the world is calling upon you to be its heroes. In chemistry, when bonds are formed, energy is released. I like to think that when we form bonds with each other, our mentors, our communities, our nation, and our world, a special kind of energy is released and gives rise to a dream. And my dream is for all of you to see yourselves the way I, your mentors, your loved ones all see you, as heroes. Heroes of justice, equity, stewardship, advocacy, public health, and so much more. If there's one thing I've learned over the past year, it's that my TDI family is going to absolutely rock this world. To end with a quote from author Marianne Williamson, "Love is the hero's journey." To my TDI family, who has shown me the power of a world filled with love, thank you. I love you.
Thank you, Umair. We're honored to have both you and Melissa represent your cohorts today. You're both going to be eloquent spokespeople for public health, so thank you. We are now going to transition to the awards section of our ceremony, and we have several student awards to give out this afternoon. Recipients of some of the awards are selected by the classmates. Others are selected by faculty and staff. So I'd like to invite our program managers, Megan Reed and Roland Lamb, to announce the Henry Masters Award recipients.
Thank you, Craig. I'm Roland Lamb, the program manager for the residential MPH and MS programs. I am privileged to have worked with each of these talented residential graduating students and so appreciate all the energy, positivity, teamwork, and sense of community you brought to each day of class this year. I know this is only the beginning of an exciting future ahead for each of you. Big congratulations. Our first award this afternoon is the Henry Masters Award. This award was established in 2010 in memory of Henry Masters, one of our students who died unexpectedly of complications from the H1N1 virus near the end of his second term at TDI. Created with the blessings of Henry's family, along with his class of 2010 classmates and TDI's faculty and staff, the award honors Henry's spirit and passion for improving health and healthcare and making a lasting difference, especially for underserved populations. Each graduating class selects one of its classmates to receive the award to honor that student as someone who continues to carry Henry's torch. For Henry's parents, Jeff and Lucy Masters, who are with us online, and for those of us who knew Henry, this day of celebration is also a day of remembrance. Jeff and Lucy Masters offered thoughts to share, and I quote, "Class Day feels particularly poignant in the midst of another global public health crisis. Henry had a remarkable capacity to synthesize complexity for good. He also had a big, booming voice and needed no microphone. Use yours at whatever volume it takes, and his work continues." This year, we have 2 recipients, one from the on-campus programs and one from the hybrid program. The on-campus programs recipient of this year's Henry Masters Award, as selected by her classmates, is Emily Berry. While Emily is coming forward, let me share a description of Emily as provided by some of her classmates. Like Henry Masters, for whom this award is named, and in a class of exceptional, positive, and smart team leaders, Emily has stood out as a remarkable collaborator and strategic thinker. She is the classmate who has most demonstrated that she values the company and joint thinking of her classmates. No matter the class, she was always at Vail and the last to leave. She often helps facilitate conversations between classmates and enriches discussion by creating space for new ideas and new voices. Emily works collaboratively with everyone in person and remotely to find solutions to a range of health challenges, including maternal and child health in the United States, health co-production, and use of technology in hospitals. Emily brings a unique perspective to each healthcare challenge with her engineering background, insightful thinking, and strategic approach. Her presentation on enabling street medicine groups to more quickly find and assist injured protesters through a mobile app that uses location services was fantastic. Emily opens the door for new questions to be asked and to challenge the status quo. She will make an incredible physician one day, and we are all wishing her much luck in this next step in her journey and studies. Congratulations, Emily, on this special award. Congratulations, Emily. I now ask Megan Reed to come forward to present the Henry Masters Award for the hybrid MPH program.
Hi, everyone. My name is Megan Reed, and I'm the program manager for the hybrid MPH program. I've had the honor of working with the hybrid class of 2022 during their entire time at TDI and watching them persevere despite completing their entire 2-year degree during a pandemic. Now I'm going to introduce the hybrid program's recipient of this year's Henry Masters Award. The recipient of this award, as selected by his peers, is Zev Allen. While Zev is already on stage, let me share a few words about him from his classmates. Though Zev and I have never met in person, it's abundantly clear that he exudes compassion, diplomacy, and thoughtfulness. In every discussion, he prompts the group with insightful ideas while simultaneously uplifting those of the peers around him. The manner with which Zev demonstrates patience and professionalism, even when faced with controversial commentary, is unparalleled. He constantly bears the warmest smile and shows up to class with positivity and confidence. All of this while pursuing not 1, but 2 advanced degrees. Talk about humble. Congratulations, Emily and Zev, and thank you again, Lucy and Jeff, for their virtually joining us today to honor Henry's legacy. I'd like to invite Craig back to the podium to present the next award.
one other thing about Zev, and when teaching in the class, if there's ever a moment when you asked a question and there was like this silence, everybody in the hybrid program knew, if I wait long enough, Zev is going to volunteer. Thank you, Megan and Roland. And congratulations, you guys. Now, I'm truly honored to present the Student Leadership Award winners. And this year, we are renaming the award to recognize the outstanding contributions of Karen Ashley, who served as an education leader at TDI for 17 years from 2002 to 2019. Karen's right over there. Her incredible leadership and management skills were instrumental in developing our MS, PhD, and MPH graduate programs. She was here from the very beginning, as well as guiding our transition from being the Center for Evaluative Clinical Sciences to becoming the Dartmouth Institute for Health Policy and Clinical Practice. As an administrator, educator, and global health practitioner, Karen left a positive, lasting impact on Dartmouth and everyone who worked with her. The Karen Ashley Leadership Award, as it's now going to be forever known, is given to the student who best exemplifies the following attributes: creates innovative solutions to public health challenges, leads impactful change, inspires others to promote and maintain a positive learning community. The recipient of this award is selected by faculty and staff who've worked closely with the students over the course of the time at TDI. So, Karen, I would like to invite you up to help me present the awards. Thank you. All right, so for the hybrid program, the 2022 Karen Ashley Leadership Award goes to Gabriella Fowler. Gabby is with us via Zoom, so you gotta turn around and wave at the camera. So she gets to celebrate with her family. Let me share a few comments about Gabby from some of our faculty and staff. Gabby consistently sets a positive tone within her cohort. Whether she is interacting with peers or with faculty and staff, she is curious, professional, and friendly. I always look forward to having her in class because I know she will be engaged, ask good questions, and support her classmates. She's cohesive. She's a cohesive, unifying presence in the class and someone who demonstrates what leading by example looks like. Gabby's enthusiasm for improving the health of others is infectious. Congratulations, Gabriella. The recipient of the Karen Ashley Leadership Award for the residential program is Caleb Curry. Come on up, Caleb. Let's see, Karen, the award's on the other side. There we go. So here's a few comments to share about Caleb from some faculty and staff. Caleb is extremely dedicated to ethics and public health principles. He has contributed extensively through community service, work, and research endeavors. Caleb is constantly seeking to understand the world from new perspectives and is always ready to stand up for the needs of others. He is known by friends to have thoughtful words of support and adorable pictures of their dog, Louie, for anyone who needs help getting through a difficult day. We look forward to following Caleb's career. Congratulations. Thank you. Congratulations to our winners, and Karen, thank you so much for being here. All right. Now, I'd like to invite Dr. Alka Dev to the podium to introduce herself and the Social Justice Award.
I'm really famous for breaking equipment, so. Hi, good afternoon, everyone. Thank you, Craig. I'm Alka Dev, and I'm an assistant professor here at TDI, and I teach in the residential program, so I know those students a little better, but happy to meet the rest. Today we are recognizing students who are improving public health or healthcare by actively engaging in social justice issues to promote equity, peace, and justice. These are qualities that we here at TDI value very highly in our students, and many of you have shown leadership and dedication to bringing about a more equal, peaceful, and just community, country, and world, as we've already heard from our student speakers. The field of public health needs ambassadors like you as agents of change and equity. And this year's awardees have demonstrated a passion and ability to be these change agents during their time at TDI. The intention of this award is to encourage all TDI students and graduates to continue to grow in their advocacy for social justice and to become these agents of change beyond their time at TDI and in the communities where you will work after graduation. The social justice awardees from the on-campus and hybrid programs for this year are listed in the program, so you should have two asterisks next to your name. So I would now like to ask all 56 recipients of the TDI Social Justice Award to please stand up for applause, and for everyone else to please join me in congratulating them. Always, Anais. Congratulations to all of you, the Social Justice Award recipients. I would now like to invite Dr. Christina Wolf on stage, who will be presenting the Independent Internship Awards for the on-campus program.
I like the woo part. So welcome, everyone. This is not in the script, but I would like to thank all of the loved ones who are here with your families and stuff, because you all rock. Our students rock. We had an amazing group of students this year in both the hybrid and the residential, and I truly believe that they are going to make the world a better place. So we have an independent internship course, which is it's an optional course, and so the students who have chosen to do an internship, it can range anywhere from 1 to 2 terms, and they look for sites, and they help people in the areas of public health, medicine, and a whole bunch of other places, so they've done really good work. Unfortunately, we can only provide awards to a select few people, and I've totally gone off script, so I'm sure people are bummed out about it. Anyway, so while the work of all of our interns, their accomplishments are all commendable, we've had a very difficult task in choosing, 6 to recognize their accomplishments at their internship sites. I'll mention their name, the title of their internship site, and then they can go up to Charlotte to get their award. So we would like to acknowledge the work of the following students in alphabetical order. So please come forward when we announce your name. So the award of intern excellence, the first one goes to Sophia Allen. Sophia's title is Evaluating the Scope and Impact of WISE Gender-Based Violence Prevention Services Specific to the LGBTQIA++ community. WISE is a service in town for people who've been have experiences of violence and discrimination, and she's helped WISE expand their services. So thank you, Sophia. Our second award of excellence goes to Divya Evula, and I hope I said that correctly. Divya's project title is National Estimates of Frequency and Costs of Hospitalizations for Children with Medical Complexity, a comparison of algorithms. This certainly would keep you up all night reading. It's very fascinating. Thank you, Divya, so much for your hard work. Do we have a thing? Sorry, you'll get your awards at the end. Okay. Do they get to come up? Oh, you don't have to come up. Okay. I guess you get to stand. But thank you, Divya. This is why they only let me do this once a year. Okay, so the next award of excellence goes to Mr. Caleb Curry, who we've just seen. The title of his project is COVID-19 Testing, Vaccination, and Psychosocial Impacts Among Sexual and Gender Minority Youth and Young Adults aged 14 to 24 years old for the years 2021 to 22. Thank you, Caleb. Our next award of excellence goes to Emerson Frizzell. Emerson may not be here today. She's currently a part-time student, and she'll receive her certificate next year. Her project title was American Board for Family Medicine Center for Professionalism and Value, Written Tool Development. She put together a series of tools for this association to help them standardize and streamline their work, so it's going to do a lot of good for them. So thank you to Emerson. Our fifth award of excellence goes to Ganea Jiwa. Her project title is Environmental Injustice in Underserved Communities. Thank you, Ganea, for all of your hard work. And our final award of excellence goes to Ishani Patel. Ishani's title is Pregnant and Postpartum Women's Perspectives on Screening, Referral, and Linkage to Services for Food Insecurity. Thank you, Ishani. And thank you to everyone who did an internship this year. I'd now like to introduce Al and Margaret Mully, who are going to present the ILE Awards. Thank you.
Good afternoon, everyone. I'm Margaret Mully, and I'm joined here by Al Mully, who we're co-directors of the program, but also Dr. Trinidad Tellez. It takes a village of faculty to do the ILE, and so there are three of us today to make sure that you understand that it's been a large team that has helped work with the students to get to this place. And I'm going to have Al talk a little bit about the program.
The on-campus ILE is an opportunity for students to work with a team of 8 faculty, the 3 of us and 5 others, along with other faculty members and mentors, and perhaps most importantly, their peers, who provide peer review during the course of the entire year. What they're doing is synthesizing what they're learning across courses during the year of study in the MPH or the MS degree. This synthesis takes place as they develop a research paper or proposal or a policy white paper in an area that is of personal and professional interest to them. And from our point of view, that's critical. Because if they believe the project can lead to meaningful, positive change in public health and personal well-being in a community, a country, or across the globe, they will work hard. They will work hard so they feel good about it at this point in time. And they do. This year, areas of interest chosen by students have ranged from understanding the nature of prenatal stress, including identification and measurement in research studies of this poorly defined phenomenon, to the challenge of making the game of football safe enough to be played at all levels without the current risk of repeated head trauma and the associated fear of long-term brain damage and loss of cognitive function. The diversity of topics makes the learning journey of each student unique as they conduct thorough literature reviews to identify gaps in knowledge and the growing edges of knowledge. And all of this is in their area of focus, something that they really care about. They develop qualitative and quantitative methods using the techniques that they've learned in other classes. And the program faculty draws upon its decades of experience to help students become experts in topics and gain skills that they can use for their entire career. We are so proud of each of them.
So before I go to, do we have awards to hand to people, or should they stand? They should stand. Okay. Thank you, I learned, yes. So on behalf of the teaching team, we are delighted to announce this year's recipients of the Outstanding Achievement in their scholarship, collegiality, and peer support during this experience. So please stand when I read your name. We're going to do this alphabetically. The first IEL award goes to Jaya Ananda Kumar. Her project title was Telehealth Interventions for Stroke Management and Rehabilitation in Low and Middle Income Countries, a Scoping Review. Our second award goes to Emily Barry. Her project title was Assessing the Operational Impact of a Hospital-Wide Point-of-Care Ultrasound Standardization Initiative. Okay, our third award goes to Catherine Connolly. Her project was Reducing 30-Day Medicare Readmission Rates in Rural America, a Policy Portfolio. And then Trini, I'm going to let you do the next one. No, you're next.
Good afternoon. I just want to share that I'm really happy to be here for this very special occasion because it also has personal significance for me. 25 years ago, almost to this day, I graduated from the DMS, the Dartmouth Med School class of '97, on this very lawn. So I'm really grateful to be here. I'm really pleased to present the fourth IEL Award of Excellence to Dr. Shefali Gladson, who regretfully she could not be here with us today because, you know, COVID. I was privileged to serve as her mentor for her policy white paper, which is a significant contribution to the field of physician workforce diversity. It's entitled Diversity, Equity, and Inclusion in Internal Medicine Residencies, the Current State and a Path Forward.
Just like the students who took IEL this year know, we have a lot of moving parts, right? You know, so we have to move things around. Our fifth award goes to Hannah Levitt. There you are. And her project was entitled The Impact of Systemic Bias on the Diagnosis Process of Systemic Autoimmune Rheumatic Diseases. And I'll let Trini do the last award.
Our last IEL Award of Excellence goes to Nicole Tanda. Her paper is entitled Policy White Paper, Drug Purity Testing as a Harm Reduction Tool.
Well, as I said, we're proud of all of the students who participated in IEL and want to recognize all of them as well as the 6 that we've named today. It's been a privilege for us to work with all of you. Next, I want to turn it over to Tina Foster for the Hybrid Practicum Awards.
Thank you. First of all, I have to say that Megan Longacre, who is the co-director of the practicum course with me, was unable to be here. And so please imagine her here. She may be watching via Zoom. If you are, hi, Megan. And she is a huge part of this course and really, really wishes she could be here. My script says, we have the pleasure of co-directing the practicum series of courses in the hybrid MPH program, and it truly is a pleasure. The practicum represents 2 longitudinal intensive experience that our students engage with during their full time in the program, so the course runs through the entire 2 years. First, students complete an applied practice experience project with a public health or healthcare organization. This is essentially their public health internship. They also complete a culminating, scholarly, and mentored written product called the Integrative Learning Experience, or IEL. For some students, these projects are linked, whereas other students may complete 2 distinct projects. For both the applied practice experience and the integrative learning experience, students present their work both in writing and through oral presentations. So on behalf of the entire MPH Practicum teaching team, we're delighted to announce this year's Practicum Award recipients for outstanding achievement in the applied practice of public health. And I should point out that our teaching team also includes a number of IEL mentors who work with our students during their IELs. So I think we are standing up for this one, so please stand, and I'll read the name and then the placement site and project title. So our first award of excellence goes to Nishan Deering. His APE was at the Atrium Health, and his project title was Maintaining an Active and Engaged Workforce to Achieve Optimal Career Satisfaction, an Analysis of Atrium Health's Engagement Strategies and Recommendations for Healthcare Systems. Our next award of excellence goes to Heidi Helgeson. She worked with the Eugene S. Farley Jr. Health Policy Center at the University of Colorado School of Medicine on a project titled The Changing Face of Rural Medicine, a qualitative exploration of factors affecting the retention of women physicians in rural Colorado. Our next award of excellence goes to Joellen Hubner. Joellen actually completed 2 separate projects for her practicum. Her applied practice experience placement site was the Norris Cotton Cancer Center for a project entitled Building Community Engaged Research at Dartmouth's Norris Cotton Cancer Center through the Community Engagement Studio Model. Her integrative learning experience project was titled Women's Responses to Experiencing Medical Gaslighting During the Diagnosis and Treatment of Endometriosis. Our next award of excellence goes to Junpei Lim, who I will say, if she could have been here, would have traveled the furthest to be here, and she was planning to come. She is in Singapore and was unable to travel. Her placement site was at the Institute of Geriatrics and Active Aging at Tan Tock Seng Hospital in Singapore with a project titled Project Charter, Quality Improvement Project to Improve Delirium Detection and Management Amongst Hospitalized Older Adults. I hope you're watching, JP. Although it's probably like 3 in the morning there or something, so she may not be streaming. Our next award of excellence goes to Juliana Maisano. Her placement site was Geisinger Health, and her project title was From Evidence to Practice, Expanding Integrated Specialty Care and Determining Value. And our final award of excellence goes to Julia Sabrick, who was at the Children's Hospital of Pennsylvania. And she worked on a project titled Characteristics and Behavioral Risk Factors of Adolescents with a History of Sexual Abuse and Assault in an Urban Emergency Department. Congratulations to all of these award recipients. I can't even begin to tell you how much work these guys do. It's amazing what they accomplish. And the contributions that they make to public health are truly substantial. So congratulations all. So I'd now like to invite Dr. Manish Mishra to announce the inductees to the Delta Omega Honor Society.
Thank you, Tina. I'm honored to introduce the 2022 Delta Omega inductees. Delta Omega is the Honorary Society for Graduate Studies in Public Health. Today, we induct graduating students from the class of 2022 who are dedicated to the quality of the field of public health and who have committed to protect and advance the health of all people. Election to the Society is based on outstanding performance, including scholarship, research, community service, and devotion to the work of public health. I'm honored to invite the 21 inductees of this year's class to stand for applause. Please stand for your recognition, and you'll receive your award with your diploma. Congratulations to our newest inductees of Delta Omega, and it's been an absolute honor to work with all of you.
Thank you, Manish, and congratulations to all of our honorees today. We've now reached the time in our program for the hoods and the diplomas. Just a little bit of background. The color of the hood signifies the institution and the concentration of the degree. So for all our hoods, the satin lining represents our institution and is Dartmouth green. For the Master of Public Health, the velvet trim is salmon, signifying public health. And for the Master of Science, the velvet trim is gold, signifying science. We will read each graduating student's name and ask each student to come forward to be hooded and receive their diploma. We do have a photographer here taking a more formal photo just off the stage. These photos will be made available to all the graduating students. So I ask you to please, the audience, please stay in your seats and while the hooding is taking place. We place tubes under each chair. Now, it's too late for everyone who's up, but tubes are where you can put your diploma when you return to your seat. So class marshals and students, here we go. I'm going to ask Roland and Megan to come forward to read the names of our graduating students, and Dr. Mishra and I will be hooding the students, and Dr. Bernardo and Dean Compton will award the diplomas. We're ready to go.
Please. Can you hear me? Is it on?
Not on.
All right. It says it's on. Oh, is it just me? It's just me. How about now? Wow, I have to use my teacher voice. Please join me in congratulating the hybrid MPH graduates. Juliana Maisano. I gotta really lean into it. All right. Hashir Abdi. Thank you. Danielle Aldretti. Zev Ashleman Allen. Morgan Lowry Bailey. Victoria Boudiette. Jason Broder. Kavi Chattergun. Nashon Elon Deering. Alicia Del Vento. Scott Glokey. Heidi Helgeson.
Thank you very much.
Joe Ellen Hubner. Melissa Pereira Lebrun. Benjamin Radford. Amy Roderick. Michelle Magara Rogelino. Kay Chandler Rosemont. Julia Bryn Sabrick. Lorenzo Cerviche. Rachel Marie Smith. Sasha Yanis.
Hey, Craig. Craig.
Okay. Next, please help me celebrate our on-campus MPH and MS graduates. Gania A. Giwa. Layla Akalal. Ahmed Shaher Mohammed Al Salman. Sophia Elise Allen. Jaya Ashwarya Anandakumar. Hiba Q. Anwar. Jenna Lynn Arnott. Monica Makram Atia. Divya Avula. Emily Cloud Berry. Laura E. Bauman. Kedrin Mia Berrien. Emily Louise Bomback. Eleanor Broy. Melissa Emily Chow. Albert Chen. Fiona Alexandra Coleman. Margaret Altergott Coleman. Catherine Ann Connolly. Caleb Wyatt Curry. Juliana Davanzano. Elise Louise Daniele. Rebecca Ariel Davis. Megan Christina Egan Reed. Kalechi Audrey Aluchier. Gunnar Henning Azayason. Eleni Fenaraki. Henry Feng. Waylon Lynn Francis Hengler. Mark A. Gabriel. Sarah I. Geller. Irvia R. Iyer. Sarah Zana Jamal. Marciana Faye Johnson. Trevor William Kaufman. Stephanie A. Lankford. Hannah Beatrice Levitt. Srinaja Maganti. Tun Jai Mai. Rishab Majumdar. Siddharth Malviya. Rohan R. Muchintala. Kim Nak Nago. Anais Altagracia Ovaje. Ashani Cam Patel. Suraj Kiran Patel. Ritwika Petluri. Courtney J. Pfeiffer. Dhruthi Saithmi Laksh Reddy. Kesha Shah. Umair Raza Sheikh. Nigam Darshan Sheth. Whitney Jade Simmons. Alexandra Rani Singh. Stephanie Ann Sutton. Claire Thomas. Kavya Venkat. Haley L. Voyer. Max Wang. Sarah Joan Westfold. Mahilet Aklilu Yared. And now the candidates for the degree of Masters of Science. Take your applause. Cameron Casella. Emily Claire Courtois. Adi Suresh. Congratulations, graduates. Nice job, you guys.
Hey, you guys, look back there. Turn around, look back there. Congratulations to all of our graduates. I have a few final comments to wrap things up. The class photo, which includes our graduating students and faculty in your regalia, will be taken immediately following this ceremony at a very funny place, Anonymous South Lawn. Just over there, behind that building. That's called Anonymous Hall. So graduates, you'll follow faculty, and we'll exit row by row, and we'll go right to the class photo. And then following the picture, there will be a photo booth set up. So if you'd like to have an individual portrait taken, you can do that. I'd like to extend just a huge thank you to the TDI education members for organizing today's celebration. It's hard to describe how much work goes into something like this, and they did an amazing job. And even when we messed up, we worked it out. We swapped the diplomas. We got it back. That's awesome. Also, a member of our team composed and played the music for today. So thank you to Nathan Levanway. And I want to thank the Dartmouth College teams, including conferencing and events, the maintenance crew, and our media production for working their magic. So thank you very much. And I want to thank our faculty for their commitment in supporting our students in their journey to become leaders in health and healthcare. Thank you, faculty. Thank you to family and friends. We heard a couple of shout-outs during there. Thank you for supporting your loved ones and for being here and for being online with us today. For every person here, you've done an amazing job supporting. So thank you, families. After the class picture, there's going to be a reception under the tent just back over there. So please join us for that. And finally, thank you, class of 2022. Thank you for choosing TDI. And Stephanie's reminding me we got to do the most important thing, man. Just flip your tassels. I'm going to leave you with some wise words from James Baldwin, something just to ponder. Not everything that is faced can be changed, but nothing can be changed until it is faced. Congratulations, class of 2022. You're now officially TDI alumni. Welcome.